Hello and welcome back to Focus Atlanta. Again, I am your host, Keisha Lancelin. Thanks so much for continuing to watch. In this segment, we get to chat with Dr. Ariana Scholes Douglas, and we're going to talk about Menopause Awareness Month.
Thanks for having me, Keisha.
Absolutely, absolutely. You know, this is one of those topics. Nobody wants to talk about it because nobody wants to go through it. But there are some things. There are some things we need to chat about, though. Yes.
Yes, ma'am.
What are the things that women need to be looking out for? You know, the things that sneak up on you. You know, the physical manifestation, the hot flashes, sometimes it's emotional. You know, you're really, quick and snippety. Those type of things are coming super duper early. What else should we be looking out for?
So thanks for having me. Yes, there are lots of symptoms that are associated with menopause, and really it's perimenopause because it's that transitional period that's leading up to the official diagnosis of menopause, which is the absence of your menstrual cycle when a woman stops for a continuous 12 months. But those symptoms can include joint pain, mood changes such as depression, anxiety, insomnia, irritability, worsening PMS, incontinence, decreased libido, and you mentioned the hot flashes and the night sweats. That's what people typically associate it with, but there's a host of symptoms that come along with it. It can come along with it.
And the bigger thing is that we feel so helpless. Like we feel like there's absolutely nothing that we can do. Your mother went through it, your grandmother went through it, now it's your turn. Is that true? Or are there things that we could maybe do to help us get through the transition a little bit better?
There's absolutely things that you can do. Things as simple as adjusting your diet, decreasing those inflammatory types of food and sugar, processed foods, increasing your activity such as exercise, just making sure you're getting adequate sleep. But the reality is that we've been a little bit misinformed about the role of hormone therapy, and estrogen is actually quite safe for several women, especially going through that perimenopausal stage. So it can really alleviate so many of those bothersome symptoms. So there are a lot of things that we can do. That's one of those myths I talk about in the book, that we're helpless and that, you just kind of have to suffer through it. And that is definitely not the case.
And that's exactly what we want women to know, right? You're not just throwing up your hands and saying, oh, well, mama went through it, now it's my turn. There are things that you can do with a little bit of research, with a little bit of, knowledge, and frankly, having frank conversations with your doctor that can perhaps help you through this transition, yes?
Yes, but the caveat there is that you need to know that a lot of providers have not been trained in this area. So another myth is that you can go to your obstetrician gynecologist. They're going to be perfectly prepared to help you through this transition. But unfortunately, we know that several doctors have not been trained, and it's very possible that you'll show up and they may dismiss you or otherwise tell you that it's something that you do need to just suffer through. So you can find a provider that can help you by going to a site called menopause.org. That is a site specifically for providers that have been trained in this area. And I think it's really important for women to know, because that's a really bad situation where women go to their providers and are dismissed, gaslit, and then again feeling like they're helpless.
Absolutely. Well, thank you so much, because nobody wants to have this transition anyway. The process of it is daunting enough as it is, but to have that feeling of not having anyone to go to just adds another level of frustration. So beyond that website, can we also talk about your website and your book and how perhaps this can be a place for us to start in terms of getting the help that we need?
Sure. So my book is called The Menopause Myth: What Your Mother, Doctor, and Friends Never Shared with You About Life After 35. And really, I wrote that specifically because I went through it, started my perimenopause symptoms around 37, and I was clueless as a gynecologist. So I learned very early that we weren't trained in this area. So you can go to that source, of course. There's several sources online, but menopause.org is a great one. And my site is drariana.com, and there are some resources there as well.
Thank thank you so much for making time for us here on Focus Atlanta. It was a pleasure to meet you.
Nice meeting you too, Keisha. Thanks for having me.
Absolutely. Okay, ladies, we do not have to go through this alone. I know that it seems daunting. I know that you feel like you're the only one going through it at the time. But again, your mother went through it, your grandmother went through it, but perhaps they didn't have the resources that we have now. There is a place to go. There are conversations to be had. Please take the opportunity to visit the website and learn more. And stay tuned to more Focus Atlanta. We'll be right back.